Good afternoon, everyone. Thank you for joining us once again for another one of our webinars in our pre-legislative session webinar series. Today we have Rachel Isherwood with us from Nevada DHHS, Department of Public and Behavioral Health, or Division of Public and Behavioral Health, rather. And she is going to be giving us an overview of Nevada's crisis response system and how it is being built out. We just have some quick housekeeping here. So this webinar is being recorded. Recordings are made available on YouTube. The handle is at NV Rural RBHC. And then we're also working with some of our other partners that we'll discuss in a second to make sure that they have the ability to also embed these on their website as well. Any slide decks are available on nvbh.org, which is the website for all 5 regional behavioral health policy boards. You should be automatically muted upon entering, but if for some reason that comes undone and it's not your turn to speak, I do reserve the right to mute you if for some reason that's causing any issues. As stated before, please enter your name, title, and agency in the chat. We are trying to keep track of who's coming to all these webinars so that we can better tailor future events to your needs and interests. We're also going to hold time for questions until the end of the presentation. At that time, you can use the raise hand function on your toolbar, or if you hit the 3 dots that say more, or it may already be on your toolbar, there's a Q&A function too. So as we go, if you want to type in your question into the Q&A, that is another option. We'll read those out. By typing it in and using the Q&A, you also have the option to ask questions anonymously if you're feeling shy. So this and all the other webinars in this series are brought to you as a collaborative project by all 5 regional behavioral health policy boards, the Nevada Public Health Association's Advocacy and Policy Committee, as well as the Behavioral Health Association of Nevada. The purpose of this series is really to help our attendees get a current snapshot of what's going on in the behavioral health systems across the state in anticipation of the legislative session. We realize that we are currently in week 2 of the legislative session. But as not too many bills are being heard just yet, I think we've got some that are starting to get scheduled for the end of this week and maybe next week. Hopefully, this information will be useful to you as you read through statute and watch the hearings. We've made our best efforts to include speakers who are both subject matter experts, but then also don't stand to gain financially or politically by participating in this series. We have 2 more webinars in this series. Tomorrow at noon, Dr. Terry Kearns from the Nevada AG's office will be giving us an overview of the Surge 2024 annual report. And then last but not least, we will have Ann Jensen from Nevada Medicaid giving us an overview of the Nevada and DOJ agreement for children's behavioral health system transformation. That is referring to the agreement you may have heard about in the news regarding the DOJ's requirements for Nevada to update the system. So that'll be really cool to kind of hear what's going on and what the plans are. A little bit about the behavioral health policy boards. There's currently 5 regions. There is currently active legislation that would combine some of those regions. The boards themselves consist of 7 to 13 volunteer members. And those different positions on the boards represent both local and professional perspectives. That includes law enforcement, treatment providers, EMS, hospitals, etc. The purpose of the boards is really to advise state-level agencies and commissions regarding what the local issues are and gaps and challenges, potential strategies for these different regions. And then each board is allowed 1 bill draft request, or BDR, each legislative session. You can see the regions here. So Just Washoe County is pink. The Northern Board, which is the western rural counties, is in yellow. I serve the rural region, which is there in blue. The southern region is most of those south and central, rural, and frontier counties. And then the Clark region includes not only Clark County, but also the southern tip of Nye to include Pahrump. Each of the policy boards is staffed with a regional behavioral health coordinator. We are the unofficial staff of the boards. We work on behalf of the boards, and we also work with all of our state partners, keep moving forward. I have the great pleasure of working with Rachel quite a bit. And so this is kind of one of the opportunities that we take to get the information out there. If you have any questions about the different regions, please feel free to reach out to your RBHC. The Clark RBHC position is currently vacant. And with that, I'm going to turn it over to Rachel.
Hi, everybody. My name is Rachel Isherwood. Excuse me. I'm the Crisis Response Section Manager for the state of Nevada. I am not good with Zoom, so I am gonna do my best with Val support. Let me see. Oop, can everyone see my screen, I think?
Yes.
Okay, I lost it on mine, so I think we're good. Um, okay, so like I said, I'm the crisis response section manager. I'm going to be providing you guys a overview of the crisis response continuum and our services that we offer, or that we provide the funding for the mechanism behind our amazing community partners who do the direct service to our Nevada communities. As well as the different components that we have in the crisis response system, and where we are at in their growth as far as programs go. Excuse me. So I like to start off with this little diagram that I created. It's an overview of what the crisis response and crisis continuum services are as a whole. So the crisis response system has three main components as provided to us from SAMHSA. The first one is the someone to talk to, which is the 988 call line, and then someone to respond, which is the mobile crisis teams, and then a safe place for help, which is our crisis stabilization centers. What I like to highlight on this slide is the effectiveness of the crisis response system when it is implemented correctly. And that's what we are striving to do with best practice standards and whatnot. Arizona saw that out of total calls received for their 988 line, 80% of those calls were able to be de-escalated over the phone. Of the 20%, excuse me, that did not de-escalate over the phone, mobile crisis teams were sent to respond, and 70% of that 20% that required mobile crisis response de-escalated in the field with a mobile crisis team. So that right there shows the numbers that when we have an effective crisis response system, we can have real positive impact on Nevadans' lives. The next slide that I also like to highlight is what the importance behind a crisis response system. On the left, you can see that we have our crisis response system, the call, chat, and text, mobile crisis teams, and then crisis stabilization centers. Without the 988 system and the crisis response system, what we see typically is that people will reoffend. They get caught up in the criminal justice system when that could have been mitigated by that person receiving appropriate behavioral health help. And that's where 988 comes in and our other program components. Other states found that with an effective crisis response system, they had a decrease in hospital inpatient admissions by 79%, as well as Colorado saw with their crisis intervention training, it resulted in follow-up care for more than 44% of individuals, which saved Colorado's jail expenses $3 million. Val, if you can stop my sharing, or I guess we can have it on in the background. That works too. Okay. So where are we at with all of this? So right now, 988, our crisis lifeline is being operated by Crisis Support Services of Nevada, a long-time standing community partner in our community. From there, we worked on emphasizing and building out our crisis response system with the understanding that our call volume is higher and continues to increase as it relates to the 988 calls. So with that, we set out to have what's called a request for proposal. In that, we requested a third-party vendor to apply to the state and provide to us a secondary 988 call center, as well as providing oversight and support to our Crisis Support Services of Nevada call center. So that contract was awarded in November of 2024. Feels like yesterday. That the vendor that won that award is Carillon Behavioral Health. So Carillon is going to be working with Nevada and our community partners to build the Southern Nevada call center, as well as provide that oversight to CSSMB. In the next couple of weeks, we should be releasing a releasing an invite for the kickoff with Carillon. The purpose behind the kickoff with Carillon is to do the who's who and introduce them to Nevada. So they can meet who our key players are, our very important community partners, and go from there to really build the crisis response system. They'll be overseeing as well as the 988 call center in the South, as I said, CSSMB, but they will also be providing the technological infrastructure for all these moving pieces. So when someone calls in and they elect to have mobile crisis team respond, that single point of dispatch will be from 988 with oversight provided by Carillon. The next component of our crisis response system is our mobile crisis teams or our mobile crisis response. Right now, we have varying types of modalities for mobile crisis teams. We have MOST, we have our rural clinics, we have our CCBHCs. So right now, what my team and I are working to do is promulgate regulations to allow for a single point of certification for these mobile crisis teams. So when someone does call and they elect for a mobile crisis team to be sent to them, it will be a certified mobile crisis team. From there, we're also releasing a contract, we're putting out a contract for a needs assessment and a catchment area study to be mapped for the entire state of Nevada for these mobile crisis team catchment areas. Where will they be operating out of? What are the services in those areas to really get a grassroots understanding of how the mapping for mobile crisis will look in Nevada? We also have our virtual crisis care program, which is a form of telehealth tablets with law enforcement. Say in our rural frontier areas, the clinician workforce is seriously impacted. It's rural Nevada. We know who we are, right? So with that, we have the virtual crisis care program that is coming to an end in June of this year, 2025. However, we are going to be working with our law enforcement partners and our community partners to build out what those relationships look like as it relates to Carillon being the 988 oversight with that contract, as well as the tablets that came with the virtual crisis care program. And last, that brings us to our crisis stabilization centers. I'm sure a lot of you have heard that we have Renown in the north that should be opening this month. And they will be having a ribbon cutting ceremony and open house, I believe. So we're working with Renown, as well as in Southern Nevada. We funded a Southern Nevada crisis stabilization center that is being operated by University Medical Center. That should be opening the first half of this year. Val, I promise to not go so fast, but that is it for my notes for crisis response.
No worries. I've got lots of probing questions that we can chew on. So for those of you in the audience who have questions, please feel free to raise your hand or drop something in the Q&A. I have a couple to get you started, Rachel.
Okay.
So what are the timelines for the mobile crisis team certification and the assessment for the mobile crisis team areas?
Yep, totally gotcha. So the contract for the needs assessment and the catchment area study, that should be released here in the next couple months. And so that work will begin this first quarter of 2025. And then you were asking about the certifications, correct?
Yeah. So I mean, when it comes down to like when's the final, and even more than just the contract, like when will these services and things be available kind of at now, or what are the timelines looking like at this point?
Right. Thank you. So for timelines, what we're looking at for our mobile crisis response, we are also interested in doing a pilot program with our CCBHCs to understand what it would look like to have that dispatch capability directly to the CCBHCs. That should be this summer as well. And as far as certification standards, I'm not the best with the promulgating regulations terms and whatnot. I do believe the certification of the mobile crisis teams will take over a year.
Okay.
Don't quote me on that yet, though.
And then would there be different types and levels of certification? Because we know that that's something that a lot of our
Yes.
communities struggle with is that, whether it would have to be that 24/7, 365, which we would all love to see, or, something that maybe operates only through different hours. Is that something that's being taken into consideration?
Yes, thank you, Val. So we are hoping the needs assessment and the catchment area study will inform us better on what that will look like for the tiers. But yes, we're fully aware and working with Nevada in the form of, and I know a lot of you guys have heard me say this before, what Pioche needs is not the same as what Washoe needs. What Washoe needs is not what West Wendover needs. So understanding that and then having the needs assessment inform us better on what those needs look like for Nevada and hearing it firsthand from those regions and communities, we're taking that into consideration for a tiered approach with the certification.
That's wonderful. Now we do have a question in the Q&A. Natasha would like to know, will the mobile crisis units have trained personnel to work with veterans and first responders who are in crisis?
Yes, that is what we're aiming for. We can't always guarantee that there's a certain level of every team will have this level of veteran status as it relates to crisis response or crisis intervention training. But that is what we're aiming for, and we're taking that into consideration at this time.
Awesome. Another question. So you mentioned that there might be it sounded like there might be some connection with Carillon and the VCC program, or at least the tablets.
Mhm.
Will Carillon be able to take on the role of that virtual crisis care or VCC program that is existing in a lot of communities? Because I know that they currently work with Avel eCare.
Correct. We're not asking for Carillon to oversee the VCC program. It's more so we're asking for them to inform us with their behavioral health expertise. They're a well-known national vendor. So we are going to take their recommendations into consideration. We just don't, we need more information going forward. And this is just me being completely transparent with you guys as community partners. We don't know what that's going to look like, but that's what we're working through right now to understand better how to utilize those benefits of the tablets for Nevada.
Okay, sorry, for some reason I put myself on mute and that was silly. Uh,
Okay.
so Fergus would like to know, how is the crisis response system funded? Is there concern in light of the state budget and possible federal funding cuts?
Thank you for the question. So let me see, this goes back to a little bit of history. And I might get the years wrong, but we were allowed to have our telecom fees. So anyone who has a Nevada area code on their cell phone bill will see a 35-cent surcharge fee for 988. That is how we fund these programs. Um, I did not see any negative impact for my crisis response system as it relates to the larger Nevada deficit in our budget. However, Carolyn did come in a little higher than we were anticipating, but we do have the funding to cover it. So I'm not concerned for our funding as it relates to the larger state deficit.
Okay, thank you. Moving on to a question about this crisis stabilization centers. So, what is the length of stay from when a person is checked into a crisis stabilization center versus and then when they leave? And then what would that experience look like for folks who are in a CSC?
So as we are growing our programs, as you can tell, 988 has taken the front. That is our number one priority right now, making sure that Carillon can come in and provide these services to Nevada with the support and oversight to CSSMV. The next step will be the mobile crisis teams. That will be our next big push for 2025 into 2026. And then what everyone will see is we're going to shift our focus to the crisis stabilization centers in roughly around the same time with the mobile crisis teams, but that will be the third and last component of it. As it relates to the length of stay, crisis stabilization centers, and this is also varying on what their licensing and endorsements look like with their associated hospital if we were to grow past, or sorry, not grow past, but grow additional crisis stabilization centers. I do have a subject matter expert on my team who oversees the crisis stabilization centers. But right now, our understanding is that it's 23 hours and 59 minutes for a stay at a crisis stabilization center. Um, we're we're working through the next steps of what does that look like after those 23 hours and 59 minutes, because sometimes that's not enough and sometimes they need more. However, also understanding that it is that person's right to, if they are not on a legal hold, they can choose to stay, they can choose to leave, or they can choose, hopefully, to have a longer stay if they feel that's necessary.
Would that be an option for people in crisis? So, for example, if someone is on a 72-hour hold, and they're brought to the crisis stabilization center, I mean, since that hold wouldn't be lifted for 72 hours, um, is there a way for them to stay longer than those 23 hours?
That's a lot of the logistical details that I don't think we have finalized yet, that we will turn our attention to in the future. So
Okay.
I don't have an answer for that right now, unfortunately. In theory, it would, I think if there was a 72-hour hold, they would not go directly to the crisis stabilization center with the time frame only being 23 hours and 59 minutes. But you guys brought up a really good point that it'll be on our plates.
Thank you, Rachel. Any other questions for Rachel? Okay, so Rachel, is there someone that people can t reach out to with more questions? What would be your recommendations there?
I will put my administrative assistant's email in the chat. And if anyone has any questions, please email her. And then just maybe in the subject line, just say 988 presentation question, and we will sort those out.
Awesome. Thank you so much. So Rachel, thank you again for all of your help, and for helping us understand what the state's vision is for crisis stabilization and crisis response. We're super excited. I know that there's a lot of interest and excitement surrounding the mobile team specifically. So fingers crossed, and hope you have a great day. If anybody else has any information or any questions after this, you can go ahead and feel free to email me as well, if that would be appropriate, and I can make sure that I connect with Rachel or other folks depending on your questions. So, okay, so Rachel put the contact information for Ms. Wilcox in the chat. She is the admin assistant and the point of contact. Thank you again, everyone. You have a fantastic day.
Thank you, Val. Thank you, everyone.